Hi, this is Ben. Let's briefly talk about changes in glomerular dynamics. To understand how filtration fraction, GFR, and renal plasma flow all change in response to a physiologic stimulus, it is important to reason through things in a stepwise fashion. Let's begin by taking a look at the afferent arteriole. Constriction of the afferent arteriole will decrease renal plasma flow by increasing the resistance of blood flow through the kidneys. Downstream, GFR will also decrease because of a loss of some of the hydrostatic pressure within the glomerulus. How do you think this will affect the filtration fraction? There will actually be no change that I'm abbreviating NC because both the renal plasma flow and the GFR will decrease to a similar extent. Constriction of the efferent arteriole will also decrease renal plasma flow by a similar mechanism. GFR will increase in this case, however, because hydrostatic pressure will build up within the glomerulus. How do you think filtration fraction will change in this case? It will increase. Moving on, what effect would an increased plasma protein have on renal plasma flow? There will be no change. However, GFR will decrease because increased oncotic pressure is inside the glomerulus. Remember, the increased oncotic pressure exerted by the plasma protein will pull more fluid into the glomerular capillaries and discourage filtration. How will this affect the filtration fraction? It will cause it to decrease. Decreasing the plasma protein concentration will also have no effect on the renal plasma flow, but it will increase the GFR. In this case, decreased oncotic pressure will encourage plasma filtration into Bowman space. Overall, how will the filtration fraction be affected? It will increase. Constriction of the ureters will also have no effect on renal plasma flow, but what will it do to the GFR? It will decrease the GFR because urine will eventually back up, causing a buildup of hydrostatic pressure within Bowman space and discourage filtration. Therefore, filtration fraction will also decrease. And finally, dehydration will cause a decrease in the renal plasma flow because less blood volume is reached in the kidneys. GFR will also decrease, but it will be to a smaller extent than renal plasma flow. So this will mean the filtration fraction will actually increase during dehydration. Now for a quick sample question. Will the filtration fraction of a patient in the early stages of shock be higher or lower compared to a normal filtration fraction? Answer: higher. This is a tough one. When people are in shock, they aren't getting enough blood flow to their vital organs. In the kidneys, this means that renal plasma flow will be low. The body responds by selectively vasoconstricting the efferent arteriole. This has the effect of directing more blood towards the glomerulus for filtration. Overall, renal plasma flow is decreased and GFR is decreased, but filtration fraction will be higher than normal in a patient with shock. Look for these types of questions on your exam because the USMLE likes for you to think in multiple steps. Thanks for listening.